pieces of a bill they may strongly oppose. David and Liz, back to you.
Okay. Thank you, Rich.
If yesterday's marathon summit doesn't get both sides to agree, Democrats may, of course, as Rich mentioned, turn to this little-used legislative process known as reconciliation to push forward with reform.
Our next guest says that would be a huge mistake. Republican Congressman Dr. Paul Broun joining us now. Doctor, great to see you. Of course, it depends whose ox is getting gored, whether people like reconciliation or not. It was used by Republicans when they were in the majority. Democrats were screaming, it's unconstitutional, we got to have the filibuster. Now it's exactly the reverse. So, again, the key here is how much this will affect the economy if it's passed, and should something that monumental be reconciled in with a simple majority.
Well, David, the leadership here in Congress, Nancy Pelosi and Harry Reid, need to listen to the American people, and they've not been doing so. The American people have spoken very loudly that they do not want a government takeover of the health care system, and that's what the leadership here in Congress are trying to do. They're trying to force down the throats through reconciliation or whatever method that they can bring about to force government takeover of the whole health care system. That's not what reconciliation is supposed to be all about. The leadership here needs to listen to America. They've spoken very, very loudly. In fact, the vice president yesterday said he didn't know what America's thinking. He needs to open his ears, and he will hear what America's thinking, because they're speaking very, very loudly.
One thing that we know is there are people, Representative, who don't have health care coverage, who would like it. Why can we not resort to something like the Swiss model, which has both a government option or choice and a lot of private insurers out there? Yet everybody has to participate. People who are getting the coverage have to pay for some of that coverage.
We can lower the cost of health care and make it more affordable for folks. In fact, I've challenged Democrats one-on-one, as well as with an op-ed that was published in the Washington Times newspaper, that would challenge, I've challenged Democrats to do a bill that would do four things: to have cross-state purchasing of insurance for businesses and individuals, to allow association pools all across the country, to allow people to have multiple options, to have tax fairness so that everybody could deduct 100% of their health cost from their income taxes, as well as the fourth thing is to establish high-risk pools in states. This would lower the cost, it would make it more affordable, and would take care of most of the problems. But the Democrats I've talked to individually have said their leadership will punish them if they were to try to promote that. That brings us to the great gap between what Nancy Pelosi, Harry Reid, and Barack Obama are trying to push, and that's a government takeover of the health care system.
Let me just stop you there, because we had Democratic Governor Ed Rendell on yesterday from Pennsylvania, and he was in favor of allowing people to purchase insurance across state lines. So it's not a monolithic rejection of that from Democrats.
Well, absolutely. In fact, I had Democrat after Democrat say that it makes sense and they'd like to do that, but their leadership will not let them. And that's the reason I wrote the op-ed in the Washington Times, so that we could get it out in the public. We can have some bipartisanship. We can find solutions that make sense, that would allow people that have difficulty buying insurance or seeing a doctor to be able to get the health care that they desperately want and need. But a government takeover is what the leadership here in Washington is trying to do, and so the difference is between a government takeover and finding some common sense solutions is a very wide gap that the leadership on the Democratic side are just unwilling to try to bridge that gap.
Well, we're following it every step of the way and through the gap. Hopefully something will come together soon. Thank you, Representative. Nice to see you.
Thank you.
Paul Broun is also a medical doctor. Now to somebody who says the industry needs to change right now, specifically